Complications of peptic ulcer disease. There are 5 complications of peptic ulcer disease, and the first one is perforation. Perforation occurs as it's associated with subsequent peritonitis, and the patient presents with sudden onset of epigastric pain that radiates to the back. On examination, you will find fever, you will find board-like rigidity and guarding, signs of shock such as tachycardia. On a chest x-ray, 70% of PUD have free gas under the diaphragm as indicated in the diagram. The next P is pyloric stenosis, or you can say gastric outlet obstruction. This occurs due to the fibrosis and the scarring of the pylorus due to chronic PUD, and the patient may present with recurrent non-bilious vomiting of poorly digested food, and the patient will have a metabolic abnormality of hypochloremia, hypokalemia, and metabolic alkalosis. So the next P we are going to talk about is peptic malignancy. In peptic malignancy, there are two types of ulcers, that is the gastric and the duodenal. So the gastric is more predisposed compared to the duodenal ulcer. The next P is penetration. Penetration, the PUD may erode the whole wall of the stomach or the duodenum and affect the adjacent abdominal structures. For example, if it's the pancreas causing pancreatitis. The last P is plast hemorrhage. It's the leading cause of mortality in PUD, and it may be acute or chronic. In acute, the patient will present with hematemesis, that is the vomiting of blood, that is coffee ground vomitus, or melena, that is dark stools. So in summary, we talked about 5 P's. Can you remember the 5 P's? Yes or no? So we talked about penetration, we talked about perforation, we talked about peptic malignancy, which we said is more common in gastric ulcer. We talked about pyloric stenosis and plus hemorrhage. And hooray, you know the 5 P's of complications of peptic ulcer disease. Thank you for watching.